Hello, and welcome to our viewers from around the globe. My name is Candy Manza. I'm a neuroscientist by training, and I'm currently the managing director of the Neuromechanics and Translational Rehabilitation Program at Penn State College of Medicine in the United States. I also live with MS, and my clinical research focuses on MS and other neurological disorders. Today's International Progressive MS Alliance webcast focuses on mobility issues and progressive MS, an area of focus for my research, along with an area of interest to me as someone living with MS. We'll be discussing the ways we're working to improve how we monitor and improve mobility and thus quality of life for people living with progressive MS. We'll hear about how one project is applying an individual approach to clinical studies on mobility. Another project is using different types of mobility training and exploring how this can help throughout a person's disease progression. And lastly, we'll hear about a project investigating how technology can help us treat mobility issues more quickly. I know firsthand how challenging it can be living with with mobility issues. I've been there during relapses myself, and I've had the experience of being healthy and active one day to relying on a caregiver the next. I know as a scientist, the struggle in the clinic in accurately capturing the mobility challenges MS patients can experience. In the clinic, we're trying to measure in just a few minutes what people with MS go through throughout their daily life, which can vary so much in a short amount of time. So I think that all of us in the MS community, whether as a patient or family member or a researcher, can benefit from understanding how mobility dysfunction is being studied and how these measures can be used to improve treatment for MS patients. And hopefully this webcast can shed some light on that. In a moment, our panel of experts will introduce themselves, but first I'd like to recognize our webcast sponsor and share some information about the International Progressive MS Alliance. We'd like to first thank Sanofi for their generous support and for making today's webcast possible. And now a little more about the International Progressive MS Alliance. The Alliance is an unprecedented global collaboration which brings together 20 MS organizations around the world, hundreds of researchers and health professionals, the pharmaceutical industry, companies, foundations, donors, and people affected by progressive MS, all working together to solve progressive MS. To date, the Alliance has committed over 60 million euros towards research and has growing an active portfolio of over 30 different research projects from around the world. Now, I'd like to introduce our expert panelists who are working on studies to address mobility challenges in progressive MS. Dr. Faes, why don't we start with you?
Hello, I'm Peter Faes. I studied rehabilitation sciences and physiotherapy in Belgium at KU Leuven. And after working 6 years in clinical practice in MS centers, I did research and became a full professor in neurorehabilitation at Hasselt University. My research is focused on rehabilitation for gait, especially walking and balance, and upper limb function in predominantly persons with multiple sclerosis besides other conditions. I look closely at walking motor fatigability, music-based entrainment and sonification to improve movements, cognitive motor interference, technology-supported training for upper limb and physical activity, pain, and community self-directed training.
Thank you, Dr. Faes. Dr. Donkers?
Hi, everyone. I'm Sarah Donkers. I am now an associate professor in the College of Medicine at the University of Saskatchewan, which is in Western Canada. I also worked clinically as a physical therapist, and I specialized in neurological rehabilitation before I went into research. And it was my clinical work that led me to research, and especially research for people living with MS. My studies primarily focus on rehabilitation interventions to improve functional outcomes and to try and promote neuro recovery for people living with MS.
Thank you, Dr. Donkers. And finally, Dr. Willingham?
Hi, I'm Brad Willingham. I'm the Director of MS Research at Shepherd Center in Atlanta, Georgia, United States. Our work focuses on the development of innovative rehabilitation strategies and technologies that can expand access to care, but also improve outcomes for those living with MS. For example, some of our current work is looking at how we can use remote monitoring technologies to expand clinical evaluation into the home and into the community to create more accessible and responsive care strategies.
Thank you. And it's a pleasure to be here with you all today, especially not only as a researcher, but I'm really excited as a patient to hear about this research that's going on. So let's start by hearing a little bit more about what each of you are working on to address mobility challenges in progressive MS. Dr. Faze, let's begin with you. I understand you're currently working on designing a clinical trial to address walking fatigability. Can you first explain to us what walking fatigability is?
Yes, for sure. The topic of today are mobility problems, which can manifest in many different manners. It can be related to fatigue during moving around. It can be related to muscle weakness that is occurring, less balance or decreased balance or less reduced fitness. Fatigability is a concept that we use not so much to say that someone has a problem with mobility, but rather like, can people keep on moving for a longer time? What do I mean if you go walking from a parking lot to the supermarket, for example, you will maybe walk for 5 to 10 minutes. And walking fatigability for us, it's a change that you may see in your gait. It may be slowing down. It may be having shorter steps. It may be having slower steps that people are making. So in a way, the motor system, the body gets fatigued and it's more difficult to keep on going for it a while. And we think that is quite common in persons with multiple sclerosis, especially if people may be feeling more muscle stiffness or muscle weakness or disbalance. It's very common as well in persons with living with progressive MS, and it can significantly impact on the quality of life.
Thank you. And so tell us a little bit about the work you're doing to currently address walking fatigability. I know that it's really hard. What you're talking about is capturing something that's happening, not in just a few minutes, and you don't have a lot of time in the clinic. So how are you addressing this?
Well, we have been taking the approach to use a test that is quite often used in the clinic. It's a 6 minutes walking test. And there we are looking to changes in the capacity of persons to walk. The 6 minutes walking test is a bit a stress test in that sense that we ask people to walk fast, however safe, during 6 minutes. And we are marking the differences between the beginning of the walking test at the first minutes compared to the later minutes. And for example, the 6th minute. In the clinic, one can document the number of meters or inches people are walking during these minutes, but we also try with sensors, with wearable sensors, to quantify the way people walk, what we are calling the gait quality. And this, we do that at the same time by also measuring the fatigue that is being perceived by persons with MS, and in that manner to understand walking fatigability.
Thank you. I appreciate that you're taking into account that everyone walks at different speeds and that throughout that 6 minutes, they can be changing their gait pattern. So Dr. Donkers, let's hear more about the research you're doing that's related to mobility training.
So although walking is incredibly important and a key part of mobility, I try to emphasize that mobility is more than just walking and standing balance. So really, we need to think about bed mobility, floor mobility, transfers, right? So getting in and out of bed, getting on and off the floor. Yes, I train everyone with MS how to get on and off the floor. Getting up and down from different surfaces, in and out of a wheelchair, maybe in and out of a car. We like to think about transitional mobility, so getting from point A to point B, which might be via walking, but it might be via a wheelchair. There's mobility in sitting, mobility in standing, and perhaps even things like running, jumping, skipping. So I really think about mobility along a functional continuum or along this span of mobility skills. And so this really is the underpinning of my current research studies. One of the more recent trials we were doing, NeuroMistral, so it looked at combining non-invasive brainstem with balance and walking training. And when we were recruiting for that study, we actually had a lot of people with MS who were interested in participating, but they didn't meet the walking ability cutoff. And I really felt like they could potentially benefit from engaging in mobility skills training. And so that was the driving force for my next study that was function first. And so we really just took those principles of that high volume, challenging, task-specific training and tried to apply it across the continuum of functional mobility skills that all depended on an individual's starting ability and what their personal goals were. So I like to emphasize that we need to be intervening across the range of mobility challenges seen in people with MS. So for individuals newly diagnosed or maybe people with more sensory presentations and less motor presentations, we know there's still a lot we can do for those mobility for improving mobility in those individuals, because higher level skills like coordination, agility, and maybe even fitness are affected there. And yes, walking in balance is important. Preventing falls is incredibly important, and we work on that too. That's a main rehabilitation goal we see. But for those individuals who are maybe using wheelchairs or only walking around in their house, maybe because of that fatigability, like Dr. Faze mentioned, we want to think about how can we continue to work on improving their mobility. So yeah, we believe training transfers, bed mobility, floor mobility with those same principles that we apply to our balance and walking training can help delay the rate of functional loss and try to minimize sedentary behavior in people with MS. And what we've been hearing from our participants so far is that participating in this type of training gives people a sense of control. It helps improve mood and psychosocial well-being. We have some individuals talk about how it allowed them to stay in their own home longer because they were able to independently catheterize or transfer to the toilet. And then something that has really resonated with me is one individual said, "I'm not as broken as I thought I was."
I can really feel the therapist coming out in your research. I love that. You have a great background for this. So what does this type of training look like?
So I call it boot camps. It is improvement-oriented training, right? So we might use some equipment, and yes, we have to make some adaptations or compensations for how someone's doing a movement. But really, it's structured around trying to improve their performance on whatever their functional task is. So our training currently is 3 times per week for 8 weeks. That's the boot camp, the heart. And then towards the end of the training, we specifically work on creating an individualized program. I call it a transfer program because we want to help individuals not only maintain some of the improvements they've made, but try to integrate it into everyday life, right? So that improvements or new ways of moving that they learned, they continue to practice. And then, of course, I always try to support, put in that message for staying physically active, because that's another element of mobility, right? Is to stay mobile.
Wow, I love that. So many times you get people that go to therapy and then they go home and they don't really know how to continue it or how to, take that to home. So you're really bridging that gap for them. I love that. So now, Dr. Willingham, you're leveraging wearable technology in your research on mobility challenges, but not the wearables we probably immediately think about when we hear that word. Can you tell us more about what you're working on?
Yeah, absolutely. So we're currently exploring a digital smart sock technology that can be used to evaluate walking function during your everyday life. These smart socks are particularly innovative because the sensors are sewn directly into the fabric. So they look like normal socks, they feel like normal socks, but they're not your average socks. They're actually measuring your walking function continuously, and they're transmitting that data to your healthcare provider in real time. So this is important because currently we rely on in-clinic assessments. And so Dr. Faze mentions the 6-minute walk. We use the 6-minute walk all the time, incredibly valuable tool. But there are some limitations, right? It's capturing a snapshot of the here and now. It's in a controlled, supervised environment. So it may not reflect, daily life, real world function and mobility. And it's limited in their ability to capture changes that may occur between visits. Furthermore, some folks may face barriers to getting into the clinic and accessing those in-clinic evaluations. So by using smart socks and other remote monitoring technologies, we can expand that evaluation outside the clinic walls. So overcoming those barriers, creating more accessible approaches, but also allowing us to detect changes that may occur more quickly and therefore act on those right away.
That's great. Thank you. Do you ever pair it with what patients are feeling? Any self-report measures, like if they're walking more on some days or walking less? Does it line up with what the patient says?
Absolutely. So that is actually an area of active investigation in the laboratory. And so we have these wearable sensors that are getting different quantitative metrics. And so walking, function, activity, heart rate, sleep patterns. But it's important to look at that quantitative information within the context of how a patient feels. And there's self-reporting of the symptoms, right? So pain, fatigue, things like this. So we've actually developed some integrated remote monitoring approaches that are capturing both quantitative and self-report measurements, and we're integrating those, and we're currently analyzing that data now.
Awesome. So I got to be honest, I'm not really familiar with the wearable technology like this. I haven't heard of the sock before. Is this the first tool like this, or is it being used elsewhere?
Yeah, so wearables are certainly a popular topic in research and clinical practice, but there have been some challenges with other approaches. So a common approach is your wrist-worn smartwatch wearable activity tracker. These can be great, but they are limited in that they're measuring arm swing. And so they're unable to measure certain specific parameters of walking function. For example, evaluating differences that may exist between the right and left side, which may be important. They also, smartwatches may not be an effective approach if you're using a cane or a rollator that limit arm swing. So it may not be an inclusive way to track activity remotely for some individuals. Certainly, laboratories have also explored placing sensors at the hip and ankle with straps or clips, and these can provide, very detailed measurements of walking function. But they are limited in that they cannot capture foot placement patterns. So, for example, they may be limited in their ability to identify foot drop, which can definitely be important in folks living with MS. And also, some of these are just bulky straps and clips that look like a laboratory instrument that folks may not want to wear out in the community. So a smart sock offers a truly wearable solution that can be seamlessly integrated into one's attire and their everyday life, but still keep them in touch with their provider and add that extra benefit of remote monitoring.
Awesome. Thank you, Dr. Willingham. Now I want to
sorry, Brad, I have a question. What color do those socks come in?
Very important question.
Great question. The question we most often get is, are they machine washable? And the answer is yes. That's a new one. So currently they are only manufactured in black. But this is very emergent technology. And so it's definitely an area we need to expand to make them fully integrated into someone's entire wardrobe. Yeah.
Love it.
Are these going to be available to any MS patient or only ones that are participating in a clinical trial with you?
Yeah, so this is a commercially available product, primarily and originally designed to evaluate performance. However, we are just recently starting to expand this technology into the clinical domain. And so that's exactly what our research is doing, is evaluating that clinical utility. So that requires, a certain level of rigor of systematic evaluation to say, okay, are the measurements valid? Is the technology usable? Is it feasible to implement in a clinical setting? And so one of the unique things about our research environment here at Shepherd is we are fully integrated with the clinic. And so all of our research is done in the clinic, in a real world clinical environment. And so in addition to getting that scientific rigor, we also get that practical information about how can we actually make a solution that can be adopted by clinicians and patients in real time.
I love that you're integrating them. That's been a struggle for myself as well, just doing the research, and with patients, it's hard for them to come in. So how can we do this research while they're already in the clinic, and how can we give that to their provider so that it's useful not only for us as researchers, for the whole community of research and for patients, but for the patient themselves right there in that moment. I think that's really important. It's great. So now I want to talk about the anticipated outcomes of each of these research projects and what you each see for the future of your area. So Dr. Donkers, can we start with you, please?
Sure. I'm really interested actually in the results of Dr. Faes and Dr. Willingham's, because as a researcher and a clinician, how do I adapt my training if some of the performance is more motor fatigability based? And one of the challenges we have is measuring functional outcomes across mobility, that mobility continuum I was talking about. We're a little bit better at measuring walking, but how do we measure or capture improvements in some of these transfer skills and sitting function? So I'm excited about that. But then with my own research, my hope is really that it can help people with MS focus on what they can do, right? So we can sort of share the message of these improvements and that people, even with more progressive MS and more severe mobility impairments, are actually engaging in this gains-oriented training with some improvements, like Of course, it's not going to cure MS, but some of the benefits we've heard have just blown me away. So I really want to try and help people with MS focus on what they can do, what MS hasn't taken away from them, find the many resources that they do have within themselves, connect them to the other resources they might need to help them take charge of their MS journey and live well despite their MS. And of course, I hope that our research findings can help advocate for improving access to such services as part of routine care, regardless of where you live in the world. And then what's next for us is try to support the brain in learning or maintaining those gains, right? So if we compare this type of practice with priming the central nervous system.
Awesome, thank you. And so I think the big question from patients is, what will your work ultimately do for people living with progressive MS? So now, Dr. Faes, what are some optimal interventions that you're anticipating will come from your study?
Yes, well, I'm also very excited to be together with all excellent researchers. And Dr. Donkers just said something important, like to which extent is it important for persons with MS to engage in intensive training programs, which are fatiguing, which takes time, which takes effort to come. And so in our research, we really want to investigate, like if you have like 1 hour of training, what has to be the components of this training? For a long time, there was the idea that you had to do exercise, which could be muscular exercise in the gym or endurance training. But from a physiotherapeutic perspective, we are more observing how people are moving and trying maybe to tailor and to find that ingredient of the pill, that type of intervention that works for you. And so in the case of fatigability, we are wondering indeed if we can improve the function of the brain, of the central nervous system, to program and to be active for a longer time. And maybe the brain needs a bit of help. For example, when people slow down and somehow cognitively lose attention on the walking or find it difficult to find the programs to walk, the motor programs, the signals from the brain, maybe we can see if we can add music or metronomes to activate the brain and to recruit the muscles in a different program, in a different manner, and make it easier to train at higher level. Maybe you have to use brain stimulation in particular cases, in particular persons. But it could also be as simple to do more intermittent training. There we mean that instead of walking 5 minutes in a row, like walk fast for 3 minutes and then take a break and again 3 minutes, or perhaps walking uphill. So we are trying to find different intervention strategies, what works for a particular patient. And we try to document that very precisely to give recommendations and guidelines to the physiotherapists working in the community and working in specialized centers to be helped to decide what to give to who. So it is a bit a complex project, I have to say. It's a bit further away from the functionality. And so I'm happy that Dr. Donkers and Brad Willingham are working much more maybe on the full scale of functional task. But we really try to give precise recommendations, like what do we see in the way people walk and what can we advise to do to improve that.
Thank you. You're really focusing on the individual, and that's so important when there's over 50 symptoms that are associated with MS. So it's really important to get to every person is different. How can we treat them accordingly? So back to wearable technology. Dr. Willingham, let's come back to you. Where could this kind of digital measurement take us, and what does this mean for the field of rehabilitation?
Well, yeah, no, that's a great question. I mean, with all the innovation that's occurring every day in the wearable sensor space and data sciences, we're really in the middle of a digital health revolution. And there are many ways this revolution may advance care for those living with MS. So with wearables and particularly smart socks, there's many ways this may directly improve rehabilitative care strategies. For example, being able to evaluate changes in real time as they occur on a day-to-day basis. This has the potential to empower patients and clinicians to take action earlier and potentially improve outcomes by preventing small changes from becoming more serious problems. So that early intervention. Also, getting information about mobility on a day-to-day basis over time also provides clinicians with deeper insight to an individual's needs and their progress. And so this lends itself towards the concept of, precision rehab or personalized medicine, of okay, this is, this individual's particular response to this intervention. These are the patterns we're seeing. Do we need to make an adjustment in order to make it more efficient? Or do we need to reconsider a different path? And so this is information that wearable sensors can inform in real time. From a research standpoint, there's also some added value with the interventions we're talking about here today. By expanding clinical evaluation into the community, you're not only seeing, okay, this clinical metric had an improvement, it's safe and effective. We're also saying, okay, what is the impact of this intervention on an individual's mobility in their real world setting as they go about their daily life? So a little bit more translational insight there. Also, if we're able to develop more precise and rapid assessment tools as researchers, this will then speed up the entire research process, right? So if we make the research process more efficient, then we can evaluate new treatment strategies more quickly and make those available to the folks who need them most in a more timely manner. So it can potentially drive scientific discovery in that way as well. So yeah, a lot of potential in this space, and I'm so excited to be a part of it and seeing where this field goes in the near future.
Thank you. It's really interesting taking that information that you're getting and providing it for the clinician. Would this be any clinician could look at this data and know exactly what it means, or does it have to be a researcher who would be able to interpret this for a patient?
Yeah, absolutely. With all of the research we do here, it always has the clinical endpoint, the clinical goal, right? So starting with the clinical need and then working backwards. And so with this project, it's no different. The ultimate goal is to have a user-friendly, practical clinical solution that can help inform care at the point of care. And so, the idea is that providers, the ultimate product will have an interface that providers can view, from their office, receive the information and take action accordingly, but also patient-facing information. It's important that we provide patients with their health information in a way that's accessible and empowers them to make more informed decisions about their care path. So that's the ultimate goal. We're in the stages right now of doing the validation and the refinements to get to that product.
I think not only are you validating the measure, but you're validating the patient, because so many patients have symptoms and they're trying to describe them and they might say, I'm getting worse from where I was before. But if you just look at it in a short amount of time, you might think, you're at the same level you were before, and the patient doesn't feel heard. So you're giving them this objective measure. And I think that's really important for the patient.
Wow, that's a great perspective. And alleviating the burden of recall, right? A lot of times at clinical visits, it's, oh, I had this change. Well, when did that happen? Oh, it was this amount of time. Well, now we have the data, right? Pull up the interface. Well, the remote monitoring technology says this occurred 3 weeks ago. And there you have it. So absolutely.
Awesome. Is there any other feedback or questions anyone has before we close this up?
Well, I want maybe to add indeed the importance of the patient engagement in all the projects, and the Progressive MS Alliance has been really wonderful to allow researchers worldwide to collaborate. That's one element. So in our case, we have 6 countries, 9 partners, many different disciplines, but of course also a person with MS. And we are also encouraged to have a group of persons with MS that are looking with us at every step of the project development. And that's the big encouragement we get from the Progressive MS Alliance. And it's so valuable to get this patient perspective during these trials. So I'm really happy about all the initiatives that PMSA is taking to stimulate us to do relevant, meaningful, and valuable research for them.
Those are great points. Thank you so much. Anyone else?
Candy, could I ask you what your research focuses on? You started off by saying you do research in MS.
So I just finished my PhD, and during that time, I was diagnosed with MS, and I was already working on stroke and lesion analysis, looking at different deficits that they have. And I was the manager of the neurorehabilitation lab, so we did a lot of upper extremity rehabilitation. So now I'm trying to use those measures that I got from stroke patients, incorporate it into the clinic for MS, and how can we just be really integrative and collect this data that we can use for, future studies, whether it's depression, anxiety, their mobility, 25-foot walk, all these different things that we can do in the clinic and then show patients the graph and say, this is where you were last time, this is where you are now. We can think about it from a medication standpoint. Is this medication working? You know, it's not just about getting new lesions, but are you having new symptoms during this time? And just trying to incorporate it. And I like going in to see patients, and sometimes when they're newly diagnosed, they think that the world, it's a terrible experience. And I've been there. So I can say I was there, and they normally end with like, but you don't look like you have MS. And I'm like, thanks. Like, you're going to feel like that one day too, you know? So it's just been a really good experience to live on both sides of the fence.
Amazing, and congratulations.
Thank you. Thank you. And thank you all for sharing your research. This has been amazing. It's been so good to hear as a researcher and as a patient. And I'm just really grateful that I was able to host this with you guys. As I hope you experienced with today's panelists, there's so much work being done to find solutions to the challenges faced by people affected by progressive MS. And the International Progressive MS Alliance continues to inspire hope and make progress by funding research that can truly transform people's lives. Still, we must and will do more to end progressive MS. Thank you to our panel of experts, Dr. Faze, Dr. Donkers, and Dr. Willingham. And thanks again to all of you watching from home, from across the globe, for joining us today. Please stay connected to the Alliance through our regular webcast and your MS organization. And please share the work of the Alliance with others. We need everyone to be a part of this effort. Together, we are stronger than progressive MS. Thank you.